Welcome back to Bloom. With the pandemic, many have put off necessary medical treatments. Joining us to discuss what safe practices patients can expect at United Vein Centers is Dr. Jamal Wazni, the founder and CEO of United Vein Centers. Welcome, Dr. Wazni.
Thank you.
Thank you so much for joining us. I'm glad that we are able to have this discussion because I know vein disease is something that does bother a lot of people. So can you describe some of the symptoms and more specifically varicose veins?
Correct. Varicose veins can be bulging. At times they may not be. But what you'll find with vein disease is that there's a pain, aching, and swelling in your legs when you've been standing or sitting for a while. At night, your legs may start to cramp or you may have restless legs. Reason for this is that the blood pools inside of the diseased veins within your legs, and these are just surface veins.
Okay, so how can we then treat that to sort of alleviate some of like not only the visual uncomfortableness, but the pain that can go with it?
The pain, aching, and swelling will go away once you remove the diseased vein. Now, back in the early days, the 80s and 90s, we would take the patients to the operating room and they would have vein stripping. These days, with technology, we have tiny laser filaments, which are slipped right into the vein through a needle, and the vein is heated closed. So it's done in the office. You walk in, you walk out, you drive yourself home. There's no downtime. So it's technology, cutting edge technology at its best.
Yeah, that sounds like a much better alternative. What about people have questions about insurance? Is this something that could be covered by health insurance?
So vein disease has been around since the beginning of time, like many diseases. It's always been covered by health insurance. Now that it's treated, when it was in the hospital, it was covered by health insurance. Now that it's treated in the office, nothing has changed with regards to health insurance. The coverage has just shifted to the office. So it's covered by all your major carriers, whether it's Medicare, Blue Cross Blue Shield, or any of the commercial carriers.
Okay, well, that's probably very good to know for a lot of people. And you guys are a leader in the treatment of vein disease and one of the premier medical providers that there are for these procedures. What have you done at United Vein Centers to sort of adapt to this new normal right now to ensure patient safety as well as confidence in going forward with procedures?
It's very important that we don't contribute to any rise in COVID. So what we have done is been hyper vigilant about cleaning, disinfecting, anything touched by staff and patients on a very regular basis. And that means handles, door handles, tables, chairs. In addition to that, we are checking temperatures of the patients and the staff daily. And that part I really love because a high temperature is a significant symptom of COVID. About 88% of the patients with COVID would present with a temperature. So that makes me feel good on a personal level. The face masks for the staff and for the patients. So these are the things that we're doing. In addition to that, we used to have many patients in our waiting room. So now what we've done is we've spread our appointments apart so that there isn't any more than one or two people in the waiting room at one time. And what we're trying to do is as soon as someone comes into one of our offices here in Tampa Bay, is we will have them go directly into an exam room, fill out any paperwork so that they're not waiting in the waiting room. So we're doing our best and it seems to be working out very well.
Good, good. My last question for you is if someone, has these vein issues, if they're untreated, what could the complications be of that vein disease?
Like many diseases, if you leave it alone and you're not listening to your body's telling you there's pain and swelling, the disease gets worse. And when vein disease gets worse, you start developing leg ulcers. We call them venous stasis ulcers. The pooling of the blood can lead to blood clots. As a matter of fact, the largest cause of blood clots in the leg is vein disease. And blood clots, of course, can break off and go to your lungs, and that could be deadly. So again, not to be mistaken with cosmetic spider veins, vein disease leading to pain, aching, and swelling is a true disease treated by medical doctors.
And you guys have the facility to do that in one of the premier locations. So if you guys would like more information, we encourage you to call 1-800-NEW-LEGS or visit unitedveincenters.com. Thank you so much for this great information, doctor, and thank you for all the precautions you guys are taking.
Thank you.